Okay. Um, so sorry we didn't get to muscular fitness. I'm really good at talking. And here's the thing, I don't even want to hear myself talk. I would much rather hear you talk, but there is a lot of content for us to get through in this class. So I'm trying to find the balance between getting through content and also encouraging you to engage and sort of apply some of this material. So I'm going to do this online and then hopefully we can have some more productive dialogue in class. So, muscular fitness testing is also important. The four components that we're going to talk about in this class are power, strength, hypertrophy, and endurance. However, I will say hypertrophy is not part of the muscular fitness testing that is considered in the ACSM manual. So, just note that difference. Um, so first, why would I engage in muscular fitness testing? So one would be to look at sort of fat-free mass and its associations with health. Also looking at changes in resting metabolic rate as a result of changes in fat-free mass. Also improvements in muscular fitness are associated with improvements in bone mineral density and glucose tolerance and in ability to perform activities of daily living. So I will say though, and this is something that sort of goes, I don't feel like ACSM does an amazing job of covering this, but that uh, muscular fitness is specific to the muscle group tested. So sometimes we'll talk about, for example, later you'll look at a chart where ACSM shows a push-up test as a an upper body muscular endurance test. Okay, well, that's great, but that's the only standardized values that they provide. What about lower body muscular endurance? Or what about like upper back muscular endurance? For example, if I wanted to look at professional rowers, that would be a pretty relevant marker to use, but we really only have basically, if I'm doing a push-up, I'm looking at chest, anterior deltoid, maybe some light like serratus lat stabilization work, maybe some shoulder stabilization work, some tricep work, a little bit of sort of core like rectus abdominis, transverse abdominis, maybe some spinal erectors, right? So I've got a lot of muscles potentially involved in the push-up, but I'm also missing a lot of muscles that might not really be looking at muscular endurance there. So note that any type of muscular fitness is specific to the muscle group tested. Also, the type of muscle action tested. So a push-up, if I'm looking at muscular endurance, right, it might measure the muscular endurance of the chest and the triceps, but although the core musculature is engaged, it's an isometric engagement, meaning it's not contracting and relaxing. It's just contracted the whole time, essentially, or it needs to be for good form, right? The velocity of the movement also matters, right? So most of you have done some kind of resistance training in the past. If you just think about doing any type of movement, if I look at a bench press, if I look at a lat pull down, if I look at a rowing motion, right? We know that the speed at which we do that thing dictates sort of how difficult that thing is. So if I'm doing a bench press, right? So I'm pushing this direction and I go up for 3 seconds and then down for 3 seconds, that takes a lot more muscle activation than going up for one and down for one, right? So thinking about, okay, do I have a standard velocity of this movement? Also, do I have a standard range of motion, right? So again, using the bench press because it's an easy target, but if I'm pressing and I'm letting the bar touch my chest and then all the way up, full like sort of lockout in terms of the extension of my elbows, right? And then all the way back down, touching the chest again. That's very different than if I come down, let's say to like a 90-degree angle at the elbow. Okay, well, now the bar's like 3, 4 inches off of my chest. And maybe that's enough depending on what my goal is. But for muscular fitness testing, it's really helpful to think about, okay, did I do this at the same sort of joint angles that the standard values are based off of? So anyway, keep that in the back of your mind as we're going through this. In the slide notes, I also have a list of health-related adaptations to muscular fitness. I went through a couple of sort of the basic ones, but I have a much more comprehensive list in the slide notes if you want. Okay, you need to know the major muscle groups. You should have these memorized. They should be in the back of your head at all times. So I like to take us from the top down. So they're on the slides, but sometimes sort of seeing somebody walk you through it is a little bit easier as well. So I'm going to try to do this in my office. So if you think top to bottom, and then front to back, you should hit everything. So we start with the shoulders, and then you have, well, let's go shoulders and then biceps and triceps. So I'll go from outside in. After that, we've got chest and back. Now, there isn't an upper and a lower back, it's just back. But note that there are pretty different muscles back there. And depending on the movement, I might hit the upper back or the lower back. And I'm not always going to hit both. So, anyway, we've got chest and then back. We do have abdominals. And then you've got glutes. So, if we move to the lower body, I've got glutes. So, I've got my glute max, yes, but I've got these side glutes as well. And then we don't group quads and hamstrings separately. So it's just legs. That's your muscle group is legs. And then calves. Okay. So a little faster. We've got shoulders, biceps, triceps, chest, back, abs, glutes, legs, calves. Okay. Those are our major muscle groups. So you can see in this picture, right? Like latissimus dorsi, right? That is a specific muscle, right? But actually, when we break it down into the 9 major muscle groups, it's just back. Okay. And then also calves would be your gastrocnemius and your soleus. Notice from the picture, tibialis anterior is not included. So you do need to listen to these lectures in order to understand what is included and what's not. Also, pectoralis, right? The chest muscles are, yes, the pec major, but also the pec minor. Okay, so we just group it into chest muscles. Okay, and then the deltoid, right, is the anterior, the posterior, and the medial. So we just say shoulder. Okay, so note that there's some sort of abbreviations there that we use that are not reflected in this picture, but I wanted you to have this anatomical picture as well. Okay. So some important principles when you're doing any kind of muscular fitness testing is to do some type of a warm-up. Typically, a 5-minute aerobic warm-up is plenty. You can also do a movement-specific warm-up. So if I'm going to do, let's say, a bench press, okay, maybe I'll do some light push-ups or some wall push-ups to get my chest muscles warm, to get that movement warmed up. Then I want to do some type of familiarization. So we did talk about this in cardiorespiratory fitness testing. If I test someone's VO2 max on a bike who typically doesn't bike, I'm going to see probably about anywhere from a 5 to a 20% decrease in their VO2 max as compared to measuring their VO2 max on a treadmill, doing walking or running if that's an activity that they're more used to. Okay, so the familiarization piece matters a lot. So if a client has never done a bench press before and I put them on a bench and I ask them to do a bench press, chances are they're going to have a pretty low value. If all I did was have them do a warm up on bench press 3 times, then the next session I did another set of warm up on bench press 3 times, and then the next session I actually measured their 1 repetition maximum. Now we would consider that more of a valid test because they've been familiarized to the movement. Otherwise, what often ends up happening is, okay, I've never seen you before. I'm going to measure your bench press for upper body strength. Okay. Well, they're not familiar with it, so they don't get nearly as high of a score. And then we come back and we do retesting and we're like, whoa, you changed so much. Part of that is just familiarization with the movement. So I want to make sure my participants are familiar with the movement first. I also want to have some type of a defined posture so that, right, if I was doing, again, bench press is an easy example. If I was doing a bench press to the bar to the chest and then full extension at the elbow, right? But then the second time I test them, I allow them to come to 90 degrees at the elbow and then back up. That's a really different movement, and I can't adequately compare those two, right? So the posture needs to be the same. The duration of the movement should be about the same. So for typical testing, we're looking at about 1 second concentric, 1 second eccentric. So my concentric is that up phase. So 1 second up, 1 second down for the bench press. Range of motion is really similar to posture, so I'm not going to go over that. And then make sure that you're using spotters. So if you're doing a bench press, maximal bench press, you should have spotters there, and you shouldn't be the only spotter theoretically. You should have a spotter on either side of the bar, similar to like a barbell back squat. Now that's different if you're using machines, of course. Okay. So then what are we actually measuring? So again, four different, we've got four different aspects of muscular fitness that we're going to talk about. For power, so power is force times distance over time. So it's the muscle's ability to exert force per unit time. And it does decline faster than strength and endurance with age. And so it's also typically a better predictor of someone's ability to perform activities of daily living. It also is a better predictor of quality of life than as opposed to strength. So in any case, some sort of interesting data there that gives you an idea. Now, the test that you can use a lot of different tests, but the test that ACSM has standard values for is the counter movement jump test. So a counter movement jump is I'm going to come down, arms are going to come back behind me, and then I'm going to jump up and use my arms to swing. So that's as opposed to sort of a strict jump, which would say, okay, I'm going to just come down. Then I actually am required to sit in this position for about a second. So I don't actually come down and then immediately back up. So there's no momentum use. But in the counter movement, it's down and immediately back up. Okay. So again, making sure that we're using the same sort of form across time, the same procedures that ACSM is using when they created these standards. Just for a little bit of context, and again, look in the slide notes for some additional stuff here, but the counter movement jump increased 3 to 26% in 4 to 12 weeks of training 2 to 3 times a week for this increase. So it's sometimes helpful to have an idea of like, okay, how much can this change with intentional training? Strength is equal to mass times acceleration. So it's the muscle's ability to exert maximal force. And remember, this is specific to the movement performed. So I could look at isometric strength production. So let's say I wanted to measure shoulder isometric strength. I would want to put some type of pressure on the shoulder pushing down, and I want to hold it steady, right? That would be an isometric strength measurement, okay? But typically what we see is more concentric, eccentric movements, looking at joint angles. Another common one used with strength is is maximal grip strength. So you'll grab a hand dynamometer, usually come to about 90 degrees, and then squeeze. That's a pretty common one for strength. There's some really interesting data on that. The two that, so you'll find that in the ACSM book, as well as standards for a barbell back squat, or sorry, not a barbell back squat, for a leg press and for a bench press. Okay, so those are all in there. Seeing if there was anything else I wanted to. Oh, the way you would want to test a 1RM or a 1 repetition maximum of either leg press or bench press would be I don't want to immediately put the weight on the bar or on the leg press that I think someone can lift. So typically you want to get to the 1 repetition maximum within about 4 trials. So my first trial I might put at like 50 to 70% of what I think their 1 repetition maximum might be. And then I'm going to increase that by 10 to 20% until I get to maximum. Okay. Usually smaller increments for upper body and larger increments for lower body. So like a 20% change maybe for lower body and maybe like a 5 to 10% change for an upper body lift. Okay, I would not want to perform a 1RM for somebody who is completely unfamiliar. So coming back to that familiarization, for somebody who's totally sedentary, that's where this chart comes in. So maybe I want to provide a 5 repetition maximum just to start to avoid going to that 1 repetition maximum. So then I would take that 1 rep or that 5 repetition maximum and I would divide it by 0.87 in order to get a guess at what their 1 repetition maximum is. Okay. Ooh, the Valsalva maneuver. I forgot that. There's a description of what the Valsalva maneuver is in the slide notes, but basically it's holding your breath in order to stabilize your core, and it does allow lifting heavier weights. Now that's okay during a 1 repetition maximum test, but I wouldn't want to repeat that over and over again, particularly without rest. So if I'm going to perform the Valsalva maneuver to increase the amount of weight I can lift with a 1 repetition maximum, I'd want probably a 3 to 5 minute break in between that and my next lift. Okay, Hypertrophy just refers to the size of the muscle's cross-sectional area, so I would want to measure that with some type of circumference. Again, you can see with this one particularly that, okay, the muscle used is really important, right? If I want to measure the size of the bicep, okay, then I've got to measure that here as opposed to like, I shouldn't be comparing that to the size of my thigh, for example, right? Additionally, it's really hard to measure the cross-sectional area of, let's say, the vastus lateralis, which is this outside portion of your quadriceps, okay? So it's really tough to measure that. So most of the time when looking at like sort of those major muscle groups, right? Like I would measure the circumference of the leg or the thigh as opposed to the circumference of the vastus lateralis. It's possible to do, and actually there's some studies that do it, but just note that it's difficult. Oh, sorry. With the Valsalva maneuver, I meant to come back and mention one other thing. It is dangerous to perform that if you have clients who have really high blood pressure. So if I have someone who I know has high blood pressure or who is on some type of a blood thinner, like a diuretic, right, I'm probably not, or a beta blocker, I'm probably not going to take them to a 1 repetition maximum. Okay, and then endurance, muscular endurance refers to the muscle's ability to perform successive repetitions against a sub-maximal load. And there are two ways to think of this. So it could be number of repetitions at a given weight, okay, and that would be absolute muscular endurance, or it could be the number of repetitions at a percentage of your 1 repetition maximum, okay, and that would be called my relative muscular endurance. So let's say my bench press, if I'm benching to gauge muscular endurance, an absolute would be, okay, I started at 125 pounds for my bench press and I tried to see how many times I could lift it. Let's say I did 10 repetitions at 125 pounds. Then 6 months later, I tested again and I just do 125 pounds and I see how many more times I can lift it. So let's say 6 months later, I can now lift it 15 times. Okay. That's how you would look at an absolute change in muscular endurance. Relative change, though, would look at, okay, my 1 repetition maximum for my bench press is 150 pounds. I want to lift 50% of that. So I'm going to lift 75 pounds for however many times I can. And then 6 months later, I say, okay, I'm going to retest my 1 repetition maximum, which is now 200 pounds. I now want to lift 50% of that, which puts me at 100 pounds, and I'm going to see how many repetitions I can do. So that would be looking at relative muscular endurance, okay? I already talked about factors that may affect the results, but right, the speed of the movement, the joint range of motion, the posture used, performing the Valsalva maneuver or not. So just be aware that the standards you're comparing people against have specific protocols. And if you really want to make those comparisons, then you should go figure out what the exact protocol is. I did talk about absolute versus relative for endurance, but it's helpful to talk about for strength as well. So let's take an individual who's, I'd say, a 50-year-old female who's 160 pounds. This individual's 1 repetition maximum for leg press might be, I don't know, 350 pounds. Okay. But I could compare that to another 50-year-old female who weighs 300 pounds, and that individual's 1 repetition maximum might be 500 pounds. Okay. So the second individual's 1 repetition maximum absolute strength is much higher than the other individuals. But typically, the way that we're going to make comparisons is relative strength. So relative to body mass. So I'm going to take whatever value was lifted. So let's say the 300-pound individual lifted 500 pounds for their leg press maximum. I would say, okay, we had 500 pounds lifted divided by my body mass, which was 300 pounds. So I get whatever that is. I can do it on my calculator really quickly. So that individual was able to lift 1.6 times their body mass, whereas the other individual lifted 350 pounds, but only weighed 160. and they were able to lift 2.1 times their body mass. Okay. So that's generally relative values is what we're generally going to use. And that's similar to cardiorespiratory fitness, right? Where we typically make comparisons across milliliters of oxygen consumed per kilogram of body mass per minute. So relative would be relative to body mass. And then general guidelines for resistance training exercises is 8 to 10 exercises for 10 to 15 repetitions twice a week for every major muscle group. And then you can add some balance exercises if the client you're working with has a fall risk. Okay, sorry, that was lots of talking. That's what this lecture is, so I'm sorry for that. Okay, here we have, I don't know if you can see that. Let me change this real quick. Okay, here we have grip strength standards by age and sex. So again, think about, okay, why would I want to differentiate by age? Why would I want to differentiate by sex? We just talked about that with cardiorespiratory fitness. Really similar principles here, right? If I think about hormone production, this is also a good place to think about if you're working with a trans population or if you're working with any population that's using hormone replacement therapy, that's going to affect these results. And so I would want to be aware of that. Typically with a trans population, I am going to compare them to their biological sex. However, it's probably not going to be a great comparison because they're using hormone replacement therapy, similar to a physique competitor. Okay, yeah, I could compare them to everyone else in their biological sex category, but they are utilizing hormone replacement therapy, which or testosterone supplementation or any type of other anabolic supplementation, which is going to significantly skew their results compared to sort of this general population. So something to think about. Um, oh, with hand grip, I wanted to bring something up. So there's a reduction in 5 kilograms of hand grip strength is inversely related to cardiovascular mortality, non-cardiovascular mortality, myocardial infarctions, and stroke. It's also a stronger predictor of all-cause mortality and cardiovascular mortality than systolic blood pressure is. So that's a pretty like ooh, that should make you think like, wow, that's like a great predictor. Um, the subsequent question is, does that mean that I should be training my hand grip strength? Should I be doing hand grip training exercises? I'm going to let you think about that for a moment. Okay, so I'm hoping that you came up with an answer. Uh, and at least for me, the answer is no, because correlation is not causation, right? So although hand grip strength might be highly correlated with these values, what would it indicate, right? So if I'm significantly losing hand grip strength, it might indicate that I'm lifting things less often. Also, if I'm doing any type of resistance training, I'm probably grabbing a dumbbell, a barbell, a machine, a band, right? And thereby, I'm going to increase my grip strength. So there are these other activities that I might be doing that would cause individuals with high grips, individuals to have higher grip strength who are engaging in resistance training. So I wouldn't necessarily encourage training grip strength, even though it has a significant relationship to a lot of different health outcomes. Now, I might measure grip strength, but I'm not necessarily going to train grip strength intentionally. Okay, here are my fitness categories for upper body strength that ACSM provides you. So again, you see up here, it's the bench press weight ratio. So it's the weight in pounds divided by body weight in pounds. Okay, so weight lifted divided by body weight in pounds. Again, age and sex stratification here. And you can see from our example, right, we were looking at a female who was 50, so we're in this category. And both of those females, the values that I gave you would have put them well above the superior range because they were looking at like, oh, wait, I did it for leg press, not bench press. I was like, wow, these are really low values. Let's take a look at it for leg strength. So for these females, right, I said, I think one was a 1.67. Okay, so even still there, right, we were looking well above average. and the other one was at a 2.1. So that would have been, both of them would have been categorized as well above average in terms of leg press strength. For males, we can see, right, values are pretty different. For one of them, one of the females, even if I was comparing them with a male standard, they would have been above average, right, in this sort of range here. And then the other one would have been well above average still. So in any case, helpful to think about some of these things. And actually your assignment, your pre-class engagement assignment for week 5 is to run through some muscular fitness testing and to compare yourself to these values, but then also to think about, okay, well, if I were comparing myself to the opposite sex, then where would I land? And if I was comparing my values to a 60-year-old's values, where would I land? Because I want you to be familiar with how these things change with age and sex. So I don't want you to just be overly focused on your own sex or your own age. I want you to focus on sort of this broad spectrum of age and sex differences that we see. Okay, then we've got fitness categories for the push-up test. Again, I don't expect you to memorize these or anything, but again, notice male, female stratification, age stratification. Here are my standards. If you are really interested, I believe in this test, they required the chest to be within an inch of the ground, and then the chin couldn't be touching the ground, I think, is how they categorized the hand or the chest positioning for this push-up. For females, it is done from the knees as the hinge point. For males, from the toes as the hinge point. So note that there are differences in also how these things are measured male to female. There is not a difference in the leg press or the bench press protocols for males and females, though. But there is for the push-ups. Okay, and then here's your counter movement jump. I should have put these in a different order, but here's your counter movement jump, again, by age and sex. And I believe, I don't have it in here, but I believe this is centimeters, in centimeters. Okay, so I want you to just think about this. You've got a 45-year-old client who you're designing an in-home strength program for. They've got free weights from 5 to 15 pounds, some exercise tubing, and maybe some body weight exercises. How would you assess their baseline strength and then strength 3 months into their program? Okay. And I think we'll come back to that on Monday, and that's sort of where we'll start. I also want you to take a look at this one and think about it. So 2 repetitions in, your new client tells you she's not comfortable continuing with her push-up test. She's 3 months pregnant and doesn't like the sensation she feels in her stomach when doing the push-ups. What alternative could you give her so that she still has a measure of muscular endurance? And I just want you to think about that. I didn't present any specific data to that. So I want you to use your brains and think about, okay, well, what would I do? I don't have another muscular endurance standard in the ACSM book. So what's my strategy? Okay, in working with special populations, a couple quick things. So for older adults, unfit adults, or frail adults, I'm going to look at some more simple tests. So like the arm curl test, there are some standards for this, and they are later in your book. So we might get there this semester, we might not. In any case, straight arm, note this assistant is letting him know, okay, this is the position at which I expect you to stop and start. The 30-second sit to stand is you can't use your arms, there's no armrest, and you have to stand up and sit down as many times as you can with proper form, so they can't just fall back into the chair. So note that there are some changes that you could make as a result of working with a different population. For children, children can safely resistance train, just for the record. So there's some sort of misconceptions around that in the fitness world. But in terms of why are we 1 repetition maximum? Why are we asking a child to go to 1 repetition maximum? Now, if this child is a power lifter, okay, well then a 1 repetition maximum might be something that I really want to include in their program. If the child's not competing, what value is it serving? Do they have some really specific strength goals? Like, I would just want to be aware of, like, what's the purpose? And I would want to be aware of that with any client, really. So I don't see working with kids as unique in that way. However, the data does support that it is safe to have children resistance train. So just wanted to cover that. Okay, so for your pre-class engagement for week 5, you will be asked to get an anthropometric and or body composition measure, so whichever one you have, your cardiorespiratory fitness measure, so you should have already done that with the Rockport 1 mile, and then a muscular fitness assessment of both strength and endurance. Now, it could be one that we've covered today, or it could be something else, and I'm okay with that. You just need to specify what you did to measure these things and why you think that that was a good measure. If available, though, I would like you to compare your results to the standardized results published in the ACSM book, your textbook. Okay. If you choose a different test, that's okay. You just won't be making this comparison. And then if you do make the comparison, I'd like you to look at how would your classification change if you were 60 years old and if you were the opposite sex. So, and I'll have that all in the assignment description for you. Okay. That's all I have for you, and I hope you enjoy your weekend.